everyone, I'm Nina. Welcome back to the Mexicali Bariatric Center YouTube channel. Today I would like to talk to you about the absorption of medication after a procedure which is malabsorbic, like the gastric bypass and the duodenal switch. Basically, when somebody wants to have surgery, they already know that they need to commit to a regime of supplementation, because precisely what makes the surgery successful long-term is also something that if you don't compensate with the supplements, that you can get malnourished or anemic. So patients get a list of the supplementations that they need to increase after the procedure. Now, but a lot of patients take medication for, I don't know, for example, pain medication or high blood pressure or whatever they may take. And they ask us, do I need to increase the dosages after the procedure? Will I absorb them normally? And the answer is yes, you will absorb them normally. You do not need to increase the dosages. Now, let me explain. When you have these surgeries done, basically you end up with two limbs, the alimentary limb and the biliopancreatic limb. In the duodenal switch, for example, the alimentary limb will carry the food and the gastric juices. And then the other one will carry the bile and the pancreatic juices. And what happens is that you eat your food and it's traveling this and this part, but the food, in order to be, for the body to absorb it, it needs to meet the bile and the other juices in order for it to be absorbed. So that happens in the common channel. Now, with these medications, you don't need the bile and the pancreatic juices in order for it to be absorbed. So essentially, you're taking your pain medication and it travels through the alimentary limb, and as soon as it hits the intestines, you start absorbing it. So it really doesn't make any difference. The bypass is a little bit different, because in the bypass, the food travels with very little gastric juices. Most of it travels on the other limb, but essentially it works the same way. Now, the vitamins that you do need to supplement to compensate are basically the fat-soluble vitamins, which is A, D, E, and K. These vitamins do need the bile in order for it to break down and be absorbed. So patients already have a list, and besides taking them, we ask them to have tests done. The first year is on month 3, 6, and 12 to make sure that everything is working out and they need to adjust. And then after that, it's yearly or every 6 months if possible. Now, I also like to mention that there's another supplement that is not in this family of the fat-soluble supplements, but that you do need to compensate. It's a very particular situation, which is calcium. Calcium is absorbed in the part of the intestine where the calcium is not traveling. It's not on the alimentary limb. So on the alimentary limb, you're going to have the calcium through the food or the supplements you're taking, but the body is not able to absorb it through this part of the intestine. It absorbs through the other limb. So since you're going to be skipping that part, how the surgery is done, it will only be absorbed on the common channel. And this is why calcium also needs to be increased after surgery. So I hope that answered your question. If you have any comments, feel free to leave them below, and I hope to see you soon. Bye-bye.